How America lost 1 million people. The magnitude of the country's loss is nearly impossible to grasp. More Americans have died of COVID-19 than in 2 decades of car crashes or on battlefields in all of the country's wars combined. Experts say deaths were all but inevitable from a new virus of such severity and transmissibility. Yet, 1 million dead is a stunning toll, even for a country the size of the United States, and the true number is almost certainly higher because of undercounting. It is the result of many factors, including elected officials who played down the threat posed by the coronavirus and resisted safety measures, a decentralized, overburdened healthcare system that struggled with testing, tracing, and treatment, and lower vaccination and booster rates than other rich countries, partly the result of widespread mistrust and resistance fanned by right-wing media and politicians. The virus did not claim lives evenly or randomly. The New York Times analyzed 25 months of data on deaths during the pandemic and found that some demographic groups, occupations, and communities were far more vulnerable than others. A significant proportion of the nation's oldest residents died, making up about 3/4 of the total deaths. And among younger adults across the nation, Black and Hispanic people died at much higher rates than white people. Understanding the toll, who makes up the 1 million and how the country failed them, is essential as the pandemic continues. More than 300 people are still dying of COVID every day. We are a country with the best doctors in the world. We got a vaccine in an astoundingly short period of time, and yet we had so many deaths, said Mary T. Bassett, the health commissioner for New York State. It really should be a moment for us all to reflect on what sort of society we want to have, she added. The first wave of deaths was concentrated in the Northeast, especially New York City and its suburbs. No one knew much in those early months. Doctors were not sure how best to treat the disease. Hospitals were overwhelmed. Deaths climbed sharply. New York City was hit harder in March and April 2020 than any other city in the country has been during the pandemic. At the height of this outbreak, a New Yorker was dying of COVID almost every 2 minutes, nearly 800 people per day, a rate 5 times as high as the city's normal pace of death. Among them was Dr. Jay Galst, 69, an otherwise healthy ophthalmologist in Manhattan, who most likely contracted COVID from a patient. His widow, Joan Galst, blamed President Donald J. Trump, who sought to quell concern about the virus in early March, asserting that it would go away with rising temperatures. She also blamed federal health officials, who declined to recommend masks for the public in those earliest days. Does it give me consolation that he was doing the work that he loved? Dr. Galst asked of her husband's death. That he was following preventive measures that we both thought was the best he could have done at the time. Not really, since I now know, had we been honestly informed of the immense danger we were all facing in New York City, we could have and would have done more. Epidemiologists have pointed to New York's density and its role as an international hub of commerce and tourism to explain the early spike in cases and deaths. Still, the earliest surge also took an acute toll in cities, including Detroit, New Orleans, and Albany, GA. A spike in emergency room visits to New York City hospitals by people who had flu-like symptoms in early March suggested that thousands of city residents were infected. On March 15, Mayor Bill de Blasio shuttered bars and restaurants and announced that public schools would close the next day. Gov. Andrew M. Cuomo imposed broad restrictions on non-essential businesses on March 22. Those near-lockdown measures were most likely responsible for a more than 50% reduction in transmission of the virus, a Columbia University study found. By summer, New York was garnering praise as a model of infection control. Death rates in New York City would never rise as high as they did in the early wave. But Dr. Thomas R. Frieden, a former head of the Centers for Disease Control and Prevention and a former commissioner of New York City's health department, said he believed that restrictions came too late. More than half of the New Yorkers who died in the earliest days might have lived, he estimated, had officials put the lockdown measures in place even a week or two earlier. Cases were doubling every 2 days, and every 2 days you were doubling the impact, he said. New York's political leaders cited lack of direction from the federal government, inconsistent messages from public health experts, and the daunting task of getting the public on board with a massive disruption of everyday life for the timing of restrictions. I don't think any of us understood the scale of it. Dr. Mitch Katz, who runs New York City's public hospitals and participated in the de Blasio administration's meetings, told the Times in March. Rich Azzopardi, a spokesman for Mr. Cuomo, said a lack of tests and the Trump administration's failure to shut down international travel seeded COVID in New York for 2 months before our first confirmed case. In an interview, Mr. de Blasio said, "It is hard to say to people when no one had died and the cases are limited, we're closing down your livelihood. We don't know when it's going to come back. We don't know what's going to happen to your life. We don't know what's going to happen to your family." Becky Bennett said she and her father, Barry, were like peas in a pod, hiking, biking, and shooting together in the Blackfoot, Idaho area. But vaccines were something they could not agree on. "Please, kitten, don't get the shot," she recalled him telling her. "You don't know what's in it." He told her that the vaccines were a government scheme to test her compliance, citing YouTube videos, even after Mr. Bennett, 72, contracted COVID in December last year and was struggling to breathe. His daughter said he was unwilling to promise her that he would get a shot if he recovered. Mr. Bennett, who was athletic and in good health, was eventually put on a ventilator in an intensive care unit. He died in January. Among wealthy countries, the United States has been notably unsuccessful at persuading residents to get fully vaccinated and boosted. Today, about a third of people across the United States have not been fully vaccinated, and some 70% of the population has not received a booster. Nearly half of the deaths from COVID in the United States occurred after vaccines were made widely available. The failure to vaccinate, epidemiologists say, contributed to hundreds of thousands of deaths. During the Omicron wave in December 2021 and January 2022, for instance, the COVID death rate in the United States was higher than in Germany, France, Britain, or Canada, which had each fully vaccinated and boosted larger shares of their populations. The vaccines have been shown to be largely effective at preventing severe disease and death. But Deborah Furholden, an epidemiologist at Michigan State University and the incoming dean of New York University's School of Global Public Health, said that deaths among vaccinated people had not been explained well and had exacerbated fears surrounding the vaccine and distrust of the government. The CDC has received data on deaths by vaccination status from only about half of the states, so it is impossible to know exactly how many vaccinated people are among the million who have died. But at least 50,000 vaccinated people, many of them older or without booster shots, were among the deaths reported since late April 2021, when vaccines became widely available. Still, vaccinated people have had a much lower death rate. Unvaccinated people have been at least 9 times as likely to die since April 2021. In recent months, states have scaled back on vaccination campaigns and incentives, and also dropped masking requirements and other mitigation measures that help protect the unvaccinated and other vulnerable people. Older people tend to have weaker organ function and immune systems, leaving them more vulnerable to disease and less likely to respond to vaccines. Indeed, age has sometimes been a bigger risk factor than vaccine status during the pandemic. People 80 and older who had gotten shots were almost twice as likely to die at the height of the Omicron wave as those in their 50s or early 60s who had not, according to CDC data. But public health experts said the reluctance of others to adapt their behavior was a contributing factor to the large number of deaths among older people over the course of the pandemic. A lot of what has effectively been a slaughter has been the product of policies and public health failings and just not caring, said Dr. Louise Aronson, a geriatrician at the University of California, San Francisco. Hispanic people ages 25 to 54 died at a rate more than 4 times as high as white people of the same age group before vaccines became widely available. Black people of the same age group died at more than 3 times the rate during that period. Meatpacking workers have been dying of COVID. Transit workers have been dying of COVID. Farm workers have been dying of COVID. At the Ralph's grocery store where Carmen Portillo worked as a cashier, the bakery manager had died of COVID. "If you don't have to come back, don't come back," Ines Portillo, 53, recalled her co-workers telling her after she took a short leave. "Because this is bad." But like many workers who came to be known as essential because their jobs required in-person work, Ines Portillo felt she had no choice. Her husband, a restaurant worker, was making less because of closures, and they had a mortgage on their home in the Los Angeles neighborhood of Van Nuys. Nearly 80% of workers ages 20 to 64 who died of COVID in 2020 worked in industries designated as essential, according to data obtained by a team of researchers led by Yehong Chen, an epidemiologist at the University of California, San Francisco. Workers in 11 sectors that were exempt from stay-at-home orders, including food services, healthcare, construction, transportation, agriculture, and manufacturing, were almost twice as likely to die from COVID as others the same age, the researchers found. About two-thirds of workers in the United States are employed in industries that fall within the classification. These workers were by definition more exposed, but the extent of the disparities was striking, Dr. Chen said. The South has also suffered because the share of adults with 3 or more chronic health conditions is higher on average than in any other region. Many chronic health problems are risk factors for the coronavirus, and several studies have suggested that 30% to 40% of all COVID deaths in the United States involve people with diabetes. It has been an uphill battle, Dr. Dobbs said, to compete with misinformation, especially on social media, and with people who tried to downplay the seriousness of the pandemic. Polarization around the virus and vaccines, he said, was devastating. Either you were fully on board or you did absolutely nothing and ran headlong into the buzz saw that was COVID, he said. For Mr. Seals, the coroner, the scale of loss has been hard to wrap his mind around. When I ran for county coroner, my biggest fear was a plane falling in my county or a school bus crash, he said. Only the grace of God and my faith kept me grounded. If you want more genre videos, don't forget to subscribe to the channel and like the video. Thanks.